Understanding Depression Relapse. Common triggers and how to manage them. Major depressive disorder, MDD, is rarely a linear journey toward recovery. For many, the path to wellness involves setbacks periods where symptoms resurface after a time of improvement. In clinical terms, this is known as a relapse. Research indicates that relapse is a common occurrence. Approximately 70% of individuals who achieve partial remission from MDD will experience a relapse, often within the first 4 months. While this can feel discouraging, mental health experts emphasize that viewing relapse as a potential part of the recovery process, rather than a personal failure, is vital for maintaining hope and seeking timely help. Why relapse matters. A relapse is more than just a temporary dip in mood. If left unmanaged, it can create a compounding cycle of stress that negatively impacts physical health, increased risk of unhealthy coping mechanisms such as substance abuse or lack of exercise, social stability, strain on personal relationships and professional performance, mental resilience, a heightened sense of shame or guilt that may prevent a person from reaching out for help. Understanding the specific triggers behind these episodes is the first step in proactive management. Common triggers of depression relapse. Because depression is highly individual, triggers vary from person to person. However, several recurring factors have been identified by medical professionals. Medication fluctuations, changes in pharmacological treatment are a primary driver of mood instability. Dosage and type changes. Altering medications can disrupt the delicate balance of neurotransmitters like serotonin, dopamine, and endorphins. The tapering trap. Even when tapering off antidepressants slowly, the risk of relapse remains high. Studies show that those who discontinue treatment are more likely to experience a return of symptoms and increased anxiety compared to those who maintain their regimen. Clinical note: it is generally advised to allow a new antidepressant at least 8 weeks to reach full efficacy before deciding it is ineffective. Significant life stressors. The distinction between good stress, which motivates, and chronic distress, which overwhelms, is crucial. Relapses are often triggered by loss and grief, the death of a loved one or job loss, caregiving burdens, the emotional and physical toll of caring for others, major transitions, significant life shifts that disrupt stability, physical health and chronic illness. There is a deep connection between physical and mental health. A new diagnosis of a chronic condition such as diabetes, cancer, heart disease, or multiple sclerosis can trigger depression. This can be due to the stress of adaptation, the side effects of medical treatments, or the biological impact of inflammatory diseases on the brain. Trauma and vicarious trauma. Trauma can manifest in several ways. Direct trauma, personal experiences of abuse or violence. Vicarious trauma, emotional exhaustion experienced by those who work closely with survivors, e.g., healthcare workers and first responders. Systemic race-based trauma. For many, particularly Black women, the experience of systemic racism acts as a chronic stressor that significantly increases the risk of depressive symptoms. Biological and seasonal factors. Postpartum depression. For those with a history of MDD, childbirth carries a high risk of relapse. Roughly 19% of new mothers develop postpartum depression, which can impair their ability to care for themselves and their infants. Seasonal affective disorder, SAD. Changes in daylight and temperature, most commonly during fall and winter, can trigger depressive episodes in sensitive individuals. Emotional anniversaries. The calendar itself can be a trigger. Holidays, birthdays, or the anniversaries of traumatic events, like a divorce or a loss, can act as psychological reminders that stir depressive feelings. Strategies for resilience. While not all triggers can be avoided, the impact of a relapse can be mitigated through proactive steps. Early intervention. Contact a doctor or mental health professional at the first sign of worsening symptoms to prevent a full-scale episode. Environmental control. Identify and minimize controllable triggers where possible. Support systems. Maintain strong social connections and consistent self-care routines to build emotional buffers. Conclusion: depression relapse is a frequent reality of managing a chronic condition, but it is not an endpoint. By recognizing triggers ranging from medication changes to life stressors, and seeking early professional support, individuals can navigate these setbacks and continue their path toward long-term stability.